All right, we're going to go ahead and get started. So I'd just like to say good afternoon, everyone, and I'd like to welcome you to the Northeast Ohio Opioid Consortium Education Series. To begin, I just want to acknowledge the vital support behind our series. Our work is funded through the Overdose Data to Action Grant, which is a program administered and supported by the Centers for Disease Control. This funding really allows Cuyahoga County to build a strong foundation of cooperation across our public health systems and public safety and other service providers in our area. Our goals working within this grant and funding are to increase collaboration that will reduce stigma, improve clinical linkages to care, and ignite compassion for those with substance use disorder. My name is Rachel Summer, and I'm here on behalf of WellLink Health Alliance that operates the Northeast Ohio Opioid Consortium. I think it's really especially fitting today that we are gathering in January, which is Human Trafficking Awareness Month. So since 2010, January has been dedicated to educating the public on how to identify and prevent this crime. The intersection of trafficking and the opioid crisis is especially significant, and today is about understanding those overlaps so we can better support the most vulnerable among us. Next slide, please. So we are very fortunate to have Kristen Hess with us as our featured speaker to guide us through this. Kristen serves as the clinical education specialist for the Office of Opioid Safety at Metro Health and is a key partner in our OD2A work. She has been a dedicated member of the Metro Health team for over 20 years, and her background perfectly embodies this multi-sector partnership that this grant aims to build. Kristen has served as a flight nurse specialist for Metro Life Flight and a firefighter paramedic, giving her unique insight into the first responder perspective. Furthermore, her experience as an education coordinator at the Cuyahoga County Correctional Center is directly relevant to our grant strategy of supporting linkage to care. So Kristen holds certifications in addiction nursing, correctional health, and currently serves on the Lake County's Adams Board. Her mission is to equip clinical staff with the education and resources needed to provide patients with every opportunity for recovery. So please welcome Kristen to our meeting today, and I'm going to go ahead and let her take over from here. While Kristen's getting started, please feel free to use the chat. If you have questions you want to enter in the chat, we'll be monitoring those throughout our session today, and we'll make sure that we respond.
Okay. Are you able to see that okay? Are you seeing my slides right now?
Yes, we are.
Okay, perfect. Thank you so much for having me. As Rachel had mentioned, I have a lot of experience in a lot of different areas, but really learning about the intersection of substance use and human trafficking is new just in the last couple of years. So we're going to cover a few things. We're going to talk about the Ohio Attorney General is really passionate about this topic of human trafficking. And as part of that, there are been some videos that have been created. So we're going to talk about how you can access them in whatever lane you're in and be able to use them to spread the word on exactly this, on human trafficking and how do we recognize it. So we're going to talk about that. And then we're going to talk about some drug trends that we're seeing and how traffickers use human trafficking and substance use disorder to feed off of each other. If you have questions, please drop it in the chat. I would rather get it at that time and just know that you have a question about something so we can address it and you get out of this what you need to get out of it. So thank you so much for having me. I don't have any disclosures. Our objectives today is we're going to talk about what are trafficking indicators, especially when it comes to working in the world of substance use disorder and addiction and behavioral health, because this is all intertwined. How do we apply trauma-informed care? And it doesn't matter if you're in healthcare or not, realizing that there is a lot of trauma that happens in these situations, and how do we best serve someone when we're trying to help? How do we enhance screening and referral? So in whatever lane you're in, if you see somebody, how do we identify and what do we do? And then we're going to talk about some of the drug trends because it is constantly changing. We have seen a lot of changes just in the last few months. And so how is that being utilized in trafficking? So how did all of this come to be? As I had shared with you, I'm relatively new to learning about this, and I really have to give a lot of credit to our forensic unit manager. Her name is Anna Becks, and she and I happened to meet at when we were onboarding new nurses here at Metro Health. And she started sharing about her wheelhouse, and I started sharing about mine. And we realized how much these two worlds live hand in hand. And it really started a grassroots initiative of education within our own system. When we started talking about how substance use disorder and human trafficking goes together, our identification rates at our hospital system blew through the roof. We went from essentially 0 cases in 2022 to our last count as of last week. I was talking to Anna, we're at almost over 100 women that have been identified as positively being confirmed as being human trafficked. So that's why we do this. There is power in collaboration, and it's really important that we all work together. And as you probably know in your world, we happen to work in silos. And I think the best benefit of her and I working together is that we have been able to bridge those gaps and break down silos. And the addiction world is talking to those who are advocating for human trafficking and behavioral health, because these patients are everywhere. And so it's really important that we continue to break down silos when we're combating this issue. This slide is a very personal slide to me. When I present this slide, I can't help but reflect on a very near and dear friend of mine. And so for those of you might be familiar with adverse childhood events, those are things that happen to us as a child that have caused trauma, and we see in addiction and human trafficking, oftentimes a lot of adverse child events. When we talk about trauma and mental health, because I said behavioral health really goes along with this as well, dual diagnosis, it's all intermingled, it's all interconnected. I had a friend that I went to elementary school up in Northeast Ohio, and her parents struggled with alcohol very severely. This led her to start self-medicating in that middle school. So any of you out there that educate in those high school and middle school formative years, that's when a lot of experimentation may start. And for her, that's what she did. And she started with THC, marijuana, and alcohol. That self-medicating, because of those things that she was living with at home, led her, by the time we graduated and shortly thereafter, to full-blown addiction. She was heavily into alcohol, opioids, and a lot of very strong substances. I was in a restaurant up in northeastern Ohio with a group of kids that I had like a party with. And she came running up to me and was like, "Christy, it's so good to see you." And literally was like, "I'm homeless, pregnant, and addicted." I kid you not. It was just like that. I sat down, bought her a hamburger, caught up with her. I had another adult with me. They took them, and we just sat down and caught up. Shortly thereafter, because of her addiction, she was recruited by the Heartless Felons Gang. That is a very powerful and bad news bears group of organized crime here in northeastern Ohio, specifically Cuyahoga County, and they targeted her because of her addiction. Let me go back to that. Sorry. Her addiction made her extremely vulnerable. That led her to be victimized. She was pregnant many, many times out in the community, and she gives me the okay to speak about her, but I don't ever tell any identifying. I don't ever identify who she is for her own privacy, but she does do speaking about her experience, her vulnerability. She was strangled by her trafficker at one point when she was pregnant, and when she woke up, she had lost the baby. She was victimized over and over again. Some of the stories that she could tell you would just make your skin crawl. That led to continued trauma and continued mental health. And how did she cope? She continued to self-medicate. I am friends with many survivors out there, and this is why I do what I do and why I talk about it, because they have said to me, if I did not have the drugs, I would not have survived my time on the streets. So understand, the whole point of this slide is that the cycle of addiction and human trafficking is a really hard cycle. It is really hard to break that cycle, and it takes a collaborative team to work on being able to help break that cycle. So what substances? How are substances used? Why are they so powerful? Why are they such a powerful weapon? They target, like my friend, high-risk individuals, anybody who has a vulnerability. We could talk for hours about what vulnerable populations are targeted. Children, kids who are out on playing video games, all those different things. But we're talking today about the substance use disorder community. And so they are some of the most at risk and vulnerable to human trafficking. The traffickers use the drugs as the control tactics. So depending on what drugs are being used, it can help to manipulate somebody, maybe taking away the pain, and it induces compliance, especially for children. Maybe alcohol is being used. It will increase the amount of hours that somebody can work if it's a stimulant. And so those are all things that we're going to talk about. Maybe if somebody's really under the influence, it's going to stop them from trying to escape. As we were talking about that cycle, we were talking about trauma. Victims often use substances to calm those memories and all of that trauma that's going on, to kind of silence that voice. And I know that was what was going on with my friend. This was something that I did not know it at the time, but when I worked at the jail, the forced criminality. So oftentimes women that I would be booking in, and I had no idea that they were being human trafficked because my eyes were not open. I did not see them. I saw them in the throes of addiction, but I didn't see the trafficking. They were being forced to engage in criminal activity against their will as a means of survival. And so that's just one of the ways that substances are used. So Anna and I worked together as her team was identifying and our staff was identifying more and more of these human trafficking cases. We sat down and we did a chart review on about 65 of them. And these were confirmed through our human trafficking task force that they were human trafficking cases. And I went through my lens and looked at what substances were being used. And 41 out of the 60 cases had like a full-blown substance use disorder. The number one substance is cocaine that I saw in that snippet of charts. Second was THC, fentanyl, amphetamines, and then benzos. We are going to talk about this in the next few slides, but I find it very interesting that this number one substance that was being used or what was being used by these women also closely mimics what we're seeing in our overdose fatalities, as cocaine has become the number one substance in Cuyahoga County and Lake County, the county that I reside in. So again, what is happening in Cuyahoga County? So this is public record, so you can go on the Cuyahoga County Medical Examiner's report and you can see how our drug trends are changing. And you can see heroin, like there was only like 20 cases of overdose deaths in 2025. It's very rare to find pure heroin these days. Fentanyl throughout the years has been the number one problem. Polysubstance use in Cuyahoga County, meaning a variety of different substances, is still what we see because there's just a lot of different substances together. But cocaine has really had an uptick. And so we're seeing that now. There was a very interesting article by Dr. Gilson. They showed it in my Lake County Adams board, and it was something that I have read here in my work in Cuyahoga County, but it really details of how cocaine is now enemy number one. And now it's deadlier than fentanyl here in Cuyahoga County. That was just released just in the last few months. That's very updated. So that has really shifted my work because when we talk about cocaine, it is very different than opioids. And we'll talk about that more in some future slides. So again, this is all data that we can access publicly. This is EMS and Project Dawn, so deaths avoided with naloxone. Sometimes you'll hear it referred to as the trade name of Narcan. And this shows how our trends in Narcan doses that were administered by EMS, how that has kind of gone down as we've seen a decline in opioids. But I want to caution you, opioids are not gone. We don't want to have a false sense of security. Opioids are still there. They are still claiming lives. It's just we're seeing cocaine kind of being more of an issue right now. But things change all the time. So when you reflect back to the data that I showed you of what substances that we were seeing and what are being reported really throughout the US as commonly used substances in human trafficking, what is it specifically about those substances that make them such powerful weapons for human traffickers? So we're going to do a little bit of deeper dive. So opioids by nature, they do what? They relieve pain, right? But they also reduce anxiety. I used to give fentanyl a lot in my patients when I worked on Metro Lifeline, because not only was I treating somebody's really usually acutely severe pain, but if they were in maybe a really bad car accident, fentanyl was a perfect drug because it also reduced anxiety. If I'm about to take a ride in a helicopter, fentanyl was a great thing because it helped to reduce anxiety and to reduce pain. Do you think you would have a lot of anxiety about being actively trafficked? Yes. And so fentanyl is something that, using that in human trafficking, if you have a quota of a 7 to 11 Johns a night that you have to service, do you think you have physical pain from that? Absolutely, you do. Do you think you have anxiety of feeling safe? Absolutely, you do. And so that is something that made that time survivable for many of these individuals. Now, just to kind of put a disclaimer out there, you may hear me refer to she a lot because most of the survivors that we encounter are women. It does happen to children. It does happen to men. We are specifically talking about sex trafficking today, but labor trafficking also does happen. So again, so that's the power of opioids. It reduces anxiety, it reduces pain. Out in Lake County, we see a lot more meth. We just had a deadly batch just a couple weeks ago near Ashtabula that has meth that was contaminated with fentanyl. So methamphetamine will keep those who are being trafficked awake. They're an alert for longer periods of time, make them more situationally aware. So you may see meth involved. Alcohol, I think that this is very common for kids if they're trying to get them into trafficking, because what kid doesn't want to have a drink? Like, oh, that's cool. I can be like an adult. It is more readily and easily accessible. It's still the number one substance that's misused in the US. And so it is very easily accessible. You will note on my statistics that I did not have alcohol noted because it isn't always definitively tested for in our patient population. And so I still think alcohol is probably the number one substance, and then cocaine. So cocaine, it creates this immense euphoria. It also and it is highly addictive very quickly. And so it makes them very reliant on that trafficker if they're the one providing the drugs, which usually they are. They accrue a drug debt, and we'll talk about that more down the line. But oftentimes, cocaine will also reduce your sexual inhibitions. And so it makes it easier to service the individuals. So for those of you who maybe don't work in the field of addiction or recovery, you may not be familiar with what are some of the things that we look for to indicate that somebody is struggling with substances. This you see here, these wounds on somebody's arm is an indication that somebody is injecting drugs. Okay. And so they kind of look for the vein. And so opioids can be injected that way. A multitude of drugs can be injected that way. And that is a very dangerous way to use drugs because it goes right into your bloodstream and it really is the highest risk for overdose. And then you might also see, oops, like my slide went by. We talk about like skin popping, which is injecting under the first layer of skin. So just in order of time, I want to keep going. But this is my friend Carolyn. That first slide was she's holding a picture of her daughter Courtney. This happened in Lake County. This was the article that I'm citing, but Carolyn's daughter was actually in a treatment facility. She was in like the equivalent of sober living. She encountered an individual there that ultimately became her human trafficker. So she had dual diagnosis. She had mental health and she had substance use disorder. She was going through treatment for both of these things, and that is where she met her trafficker. It is an absolutely devastating story, but on February 7th, they found her deceased here in Cuyahoga County after she had been human trafficked throughout many states after being recruited by this individual. Why? Because she was vulnerable, the mental health and the substance use. She was found in an abandoned home here in Cleveland of an opioid overdose. And so again, they saw her vulnerabilities and they ended up trafficking her. And so Carolyn now works very hard advocating for her daughter, and I refer to her in many of my presentations to honor her because it's exactly her case, sadly, really does show exactly the intersection that we're talking about. Now, we're getting to the Ohio Attorney General's. Like, this is where the Ohio Attorney General's office, like I told you earlier, has really been working very hard to work and focus on organized crime. So they have this commission that works for to detect multiple multi-county criminal networks. So their task forces, not to go on this too much of a deep dive, but they really talk about both worlds. So they're looking into drug trafficking, human trafficking, some of the legal gambling, things like that. And so this task force is kind of where these videos that we were talking about kind of came to be. And so not only are they actively going out and trying to stop operations, but they're also trying to educate. And so that more eyes are opened. And so there were lots of cases in northeastern Ohio in our counties, in Medina, Cuyahoga, Summit, Stark counties had some of the largest seizures. There was a very big um, case called Operation Next Door. And I'm not going to read all of this off to you on this next slide, but it just speaks how large of an operation this was. They had 100 agencies, 135 arrests. 67 survivors were recognized. That's huge. There were raids in Toledo, Cuyahoga, Cleveland, Summit, Akron, and more. And this all happened in 2025. So it is happening in our communities. And this was all throughout these months, the people that were found and where they were found. There was a massage parlor right in my back door in Menor, Ohio, that was part of this. And so, right here in November. So, this was a very large initiative that was happening. So, again, it happens in a lot of places in Ohio. So, we are not immune to this. So, that's my point in that slide. Now, if you want to find after today, there is on the Ohio Attorney General's office on their website. This is the link that I have here. It says, if you forget, you can Google healthcare training videos, Ohio Attorney General, and it will take you to this next slide. And so this is where you find there is 6 videos altogether. And in the paragraph on the opening page, you'll see this facilitator's discussion guide. It is a 50-page document that accompanies all of these videos. So there's one for EMS, and this is what the guide looks like. And it gives you all the teaching points. So you do not have to be an expert. If you have an office and you're like, I want to watch this video, the guide walks you through what discussion points so you all can learn together. You do not have to be an expert. I promise you, you will learn something from this. So I just wanted to show how do you find it? And I cannot recommend them enough. So I am part of a healthcare subcommittee that actually wrote this video that we're going to be watching. But these are the videos that are available. So the OB setting, when the parent is a trafficker. Anybody should watch that. If your kids play sports, if you work with youth, just recognizing because these kids do go to school. So this would be very important. Harm reduction setting, that's the one we're going to watch today. Labor trafficking in the emergency room, a message from a survivor. If we have time, we will watch that message because it is very powerful. And if not, you can do it later. And then there's one for fire and EMS. And I use this in teaching fire EMS. But this is just an example of how it walks you through all the discussion points of what to discuss. There's different breaks in the videos. So we're going to go ahead and we're going to watch this. This was taped at Metro Health, and we'll have some discussion points as we go through.
Keep clean, and I don't have the right stuff. And I feel like really it hurts. It smells nasty. But he wants us to keep moving, and
It's okay. If it's okay with you, I'd like you to come and talk to my nurse, Celia. She's a former ER nurse, and she might be able to help you with the wound, because it seems to really be bothering you.
It smells really bad.
I know. It's okay, though.
Okay, I just don't want to be ER. They were really mean last time, and my boyfriend says nobody cares about me, and they're just gonna call me a D, and that no, they're not gonna help me, and I don't want to go through it. And that,
First of all, you're not a junkie, and I'm so sorry that that happened to you. But let Celia take a look at it for you and change the dressing for you.
okay, we just have to do it quickly.
Sure, we will. Okay, Tanya, this is Celia. She's my nurse. She's gonna take a look at your wound. Okay.
Would you like a water? You look really uncomfortable. Here you go. Like Sarah said, my name is Celia, and I was an emergency room nurse for years. So if it's okay, I want to take a look and see what you got going on. I might be able to tell whether or not you need to go to the hospital. It's kind of sounding like you might need to.
Do you want me to take this off?
If we can slide just your one arm out, that would be fine. Okay.
Need some help?
You
Let me
got
know.
it? Okay. How bad has this been hurting you?
Really bad.
Have you been finding you need to use a little more often than normal? Yeah. Do you smell anything funny coming out of it? Okay. How have you been feeling? Are you more tired than normal?
Yeah, I'm like kind of dizzy, but my boyfriend gets mad if I'm tired.
Okay.
So he keeps us moving.
Are you able to rest when you need to? Like, are you staying somewhere safe, or you're kind of on the move a lot?
He keeps us moving.
Okay. I'm just going to take a look here.
Oh, this is
Okay. Okay. Yeah, this is pretty concerning. I'm gonna get this cleaned up, okay? We're gonna put a clean bandage on, but I'm really concerned of how this is looking, okay?
Experienced staff are trained to notice red flags. Tanya's wound suggests prolonged exposure to xylazine from IV drug use. Celia is concerned that her wound is infected and that she needs urgent medical care. Her mention of a controlling partner, lack of stable housing, possible withholding of drugs, and visible fear all raise red flags of potential trafficking.
You've been doing a really good job with this wound, but this is above and beyond what I can take care of here out in the community, okay?
okay.
I think it's time that you might need some antibiotics and get this taken care of.
I don't want to go to the ER. Last time I went there, they were really mean to me, and they called me a junkie, and my boyfriend says that, like, nobody cares about me, so they're not going to help me.
I'm really sorry that happened to you. But here's the thing. We have a navigator now at the hospital, and their job is to meet you where you're at, and they will help make sure that we treat the withdrawal when it starts coming so that we can keep you comfortable and get this taken care of, okay? Because this is pretty bad. You've been doing a really good job, but this is above and beyond what we can take care of, okay? So let me tell you, I have a friend. Her name is Mary. She's an advocate. She can come out and talk to us now. I'll have Sarah to call her. She's been through a lot of what you're telling me about, and she has a lot of resources because we can help you with a lot of stuff here, okay? But she can go to the hospital with you and stay with you, and she'll also help make sure you meet that navigator so we keep you comfortable. They can give you lots of resources to keep you healthy and comfortable and get this wound taken care of, okay? You don't have to do this alone, all right? You're not alone in this, and we're going to help you, all right? Is it okay if I have Sarah go ahead and give her a call? Okay.
Okay.
Sarah, can you go ahead and call Mary, please? Let's get her over here and see what we can do.
Sure, no problem.
I think we probably need to call a squad to have her drive over too,
Okay.
okay? All right. We're going to get you feeling better, okay? You're doing a good job. Okay.
Okay.
Okay. Well, we'll just go ahead and let it play rather than stopping. But there were a lot of red flags. The behavior, she had a lot of not wanting to go to the hospital because of how she's been treated. Tanya, this is my friend Mary that I told you about. She's going to talk with you a little bit while we wait for the squad to come and get you.
Hi, Tanya. My name is Mary. I am not a nurse. I am not a doctor. I am your advocate. I am here to help you however you need to be helped. Okay? So I see you do. Would you like to talk? It's no pressure.
I said I would go to the hospital, but my boyfriend's outside. I don't know. I don't know if I can take this long, but I really don't want to lose my arm.
Okay, well, we can do something about that. So we are going to go to the hospital, right? Okay. How about if we have your boyfriend drive, and would you like for me to ride with you? sit up there and make sure everything okay?
Yeah, she said you would help me going potentially through it in the hospital.
Oh, okay. Well, I know you're going through withdrawals, but that's okay. I know it's real hard. We can get you some medication there. Also, my friend Jordan, who works for the Sun Navigator, Substance Abuse Sun Navigator, she will always be there. I understand they already talked to you a little bit about this.
Mm-hmm.
So would everything be okay? All right then. Well, we'll be make you as comfortable as possible. Okay.
I think I hear the squad pulling up.
Okay. All right. So I was putting it up. Here we go. We're about to go. Okay. Would you like me to help you carry anything, or are you okay?
I'm okay.
Okay. Here we go.
We'll go ahead and keep going because we'll kind of hit the discussion points when we're done here.
Hey, hi, you
Hey,
two.
Mary.
Hi. I just wanted to thank you for reaching out to me and for reaching out to Tanya for helping her for the things that what she's doing. She's getting help right now.
Oh, wonderful. How's she doing in the ED? Are they helping her with the withdrawal and make her comfortable?
Yes, they are. Yes, they are. She was sitting up there. She was admitted for the son admitted her.
For the wound?
Yes, for
The wound. The doctor admitted her for the wound.
Yes,
and
for the
son.
comfortable,
Okay.
right, from the son. And now we're going through, they started her protocols for her withdrawal to make sure everything's okay. And so I'll be working with her, the Sun Navigator. We will sit up there and we'll get a plan together. And I will fit in with that plan and I will follow her wherever she goes.
That's really good. I'm just so glad we had the training to pick up on all the red flags that we were seeing. There were so many red flags we saw.
I couldn't agree more. I truly do think that she was being trafficked, even though she didn't directly say so.
I mean, the way the boyfriend and the way she kept looking out the window and the way he was pacing, she was so nervous about him. Like she was very unsettled.
Right. Well, I'm glad that we was able to keep her and the boyfriend separated for safety.
100%. When you went in the squad with her, and he was told to drive the car, that gave the perfect opportunity just to keep them apart. That was perfect. That was really good.
Okay.
Well,
and what about I heard the clients sit up here, you refer to clients as in a day in the life?
We were talking about a lot of the clients refer to themselves as being in the life, and maybe they're not ready for help, but the fact that we have you as an advocate and we've had the proper training and we were able to recognize the red flags.
This story reminds us that compassionate, stigma-free care is more than treatment, it's a lifeline. Education and awareness are vital to recognizing exploitation, especially when addiction is involved. By learning to recognize the hidden intersections of substance use and trafficking, healthcare providers can intervene more effectively. Harm reduction workers are often the first trusted point of contact. Your empathy, vigilance, and willingness to look deeper can help break the cycle of addiction and exploitation. In the fight against human trafficking, every moment of care matters, and everyone has the power to make a difference.
You are awesome.
Thank you so much. I'm so glad you found us. Thank you.
Yes.
Thank
Just
you.
wanted to let you know.
This is what it's about.
Thank you. Thank you.
Thank you. Okay, that's essentially it. This is their new human trafficking hotline, which is a statewide hotline. I will tell you, we do have a local hotline, which I'm going to show you here at the end of the presentation, that is really the best for us in Northeastern Ohio because it goes directly, and it's sometimes the statewide number has to get rerouted, and it takes a little bit of a delay. So I will go back and share my slides, but at this point, so you saw that there were pauses in the presentation, and like in the guide it says here like pause 2, and I wanted to explain a couple of things that if all the technology trolls weren't hitting us, what we would do is pause and kind of talk about those points. And so if you were using this to teach your groups, what you would do is talk about safety. Let's say that human trafficker was starting to escalate and you didn't feel safe. What are your safety protocols, whether you're in a clinic setting, whether you're in a mobile unit like that? Do you have protocols? Do you have a panic button? The reason why in that scenario we ended up calling the advocate was so that somebody was with her that she felt safe to go to the hospital, and so that she had someone there as a support, and so that we could separate from the trafficker. Because had she gone outside to tell him she was leaving, he would have had her get in that car, and her opportunity for help for the wound, for the addiction, and the potential human trafficking would be gone. And so that is why in that scenario, it played out that way. It wasn't meant to have a big conversation and really get into a deep dive of thoughts and feelings and emotions. It was to say, hey, this is Mary. She's going to go to the hospital with you if that's what you want, and we'll have him drive his vehicle. So let me go ahead and share, but it really goes through. And let's see here. Let me. Okay. Okie dokie. We can see we're good. So some of the indicators of sex trafficking or we saw that tension, right? We saw the tension of him pacing outside there. There was really no eye contact. She didn't want to make eye contact. Sometimes there might be a discrepancy in the person's age and what they're saying and their apparent age. Somebody might be a lot younger and they're trying to pass to somebody who is older. There's all these different things that we may have as red flags. And these are things that working in the field of addiction, you can come across. There might be a history of abuse. We see a lot of involvement in the juvenile justice system. We are going to talk about tattoos here in a little bit. Some of the verbiage and the lingo that you may hear, and I was hearing this at the jail and did not realize what it means, is big mama or auntie or cousin or uncle. Those things, those terms are very common words in the world of human trafficking. If this person has no identification, if they come in and they have 3 and 4 cell phones or multiple hotel room keys, those are all red flags. Things from they may say to you, depending on what area that you're working in, they may say, you know what, I've had a lot of female problems. We see a lot of recurrent infections, multiple pregnancies, abortions, and miscarriages. That is something my friend experienced. A lot of dental problems. You see dental problems not only because of the substance use disorder, but they don't have the time to keep up on their personal hygiene. We're going to talk about the suspicious tattoos and brandings. Stories that don't make sense. They're depressed. You saw how depressed she was and how I don't want to go to the hospital. Nobody's going to believe me. They're going to treat me terrible. And it's sad, but in the world of addiction, unfortunately, that's the experience that a lot of patients have had when they go to healthcare systems. So we're going to talk real quickly about tattoos. And you're like, I had no idea for 20 years of being a nurse that this world even existed of tattoos. And here's the thing, working at the jail, I reflect back at a lot of the tattoos that I was seeing, and it makes sense. The take home is that these tattoos are a form of ownership and bondage. They are given to these women and children against their will, and they look like everyday average tattoos. It is the emotional response that you get when you ask about the tattoo that you realize that this is a trafficking tattoo. So as a nurse, you'd be like, oh, that is a really neat looking tattoo. Like I have butterfly tattoos. It could be something as simple as that. These are not off our patients, but property of tattoos is very common. Now, you sometimes can see that in gangs and motorcycle clubs, things like that, showing like if the husband is or the significant other, sometimes it'll have property of, but names, crowns are very big, things like that. So if you're like, oh, I don't know if that's a human trafficking tattoo, just be like, oh, that is a really beautiful tattoo. Did it hurt in that spot? And if they go, I don't want to talk about it, most people who have tattoos are like, oh, thank you, because I spent a lot of money on it. But it's the response. It can be very, very different. This is something they do not want to talk about, and it lasts for a long time. Just know that asking someone about saying, are you being human trafficked? We don't do that. We want to get the person. If we think that they're being trafficked, as you saw in that video, we want to get them to somewhere where there is a qualified individual that can have those really difficult conversations. That is the last thing we want to do is be like, are you being human trafficked? Why? Because, sorry, let me go back to that. They often do not see themselves as victims. Okay, they have a lot of shame, self-blame. She was projecting that in that video. They can often be fearful or distrustful of healthcare, law enforcement, and especially all of that is compounded if addiction is in that. So you will see that that was videotaped on our expanded mobile unit. And harm reduction is really key in what we're going to talk about, because we're going to talk about a little bit more about how the drugs are used as traffickers. And I realize we're getting close on time here. But it's really important for anyone who's working in the addiction and behavioral health space to be aware that this happens. Our expanded mobile unit at Metro Health does a lot, but what it really, I think, is their strong point is they bridge a gap of trust, and they show so much love to our clients. They hand out clothes in the winter. It's brutally cold. They hand out food in the summer. So when that person says, "Hey, Steph or Cindy, I need help," there is that level of trust that there hasn't been any judgment and that I will walk alongside you. And so anyone who's working in this space, that is how we should handle our patients and our clients, is that how can I walk alongside you when you're ready for help? So this is a QR code that you can scan, and it will take you to a lot of the resources that we have at Metro Health, which is very, very helpful. This is a vending machine that we have at Main Campus Metro that does have Narcan. It does have some safe use supplies. There's not syringes in that. The only place that we have syringes are in our exchange. One of the really neat things that this is kind of going to bridge into that next conversation of what substances we are seeing is that our mobile unit will offer this service with the Cuyahoga County Medical Examiner, because they are such a strong partner in our work. They support our office. They are wonderful. What they will do is they will offer for a syringe that someone has turned in that they have been used for injecting drugs. And they will say, "What do you think that you're using?" "I think I'm using heroin," for instance. Well, then they test that syringe and it shows exactly what is in the drug supply. And it's all done confidentially, but like this was their last public data that they published. And there was about 190 tests done. And so this shows you heroin was the most common drug that was expected. But what was really showing up was fentanyl, cocaine, metamethadone, xylazine, methamphetamines. So you think you're using one thing, but you're having, remember how I said polysubstance use is very, very common? So that's something that our syringe exchange does. And that really helps us for those who work in this addiction space. This also shows exactly what else we're seeing: fentanyl, cocaine, meth, xylazine, heroin. And it shows, and then we talk about nitazines, different benzos. And then, so this is a really great information that they released. And so again, the adulterants. So what are things that are being added to the drug supply that we're not expecting to be there? And then what are those that we're seeing? The participants, a lot of male and some female, and what zip codes they came from. So this was really important. It was done by the OD2A. And so it really helps to understand, because these two worlds, like I say, do collide, and these substances are being used in human trafficking. So to give you a real quick blurb about what is xylazine, what is metamethadone, and what are these dangerous adulterants that they're finding in our drug supply. Xylazine is actually an animal tranquilizer. It causes really bad sedation, and it doesn't respond to Narcan because it's not an opioid. But what it does do is create these really bad wounds. We simulated that she had a xylazine wound because we are seeing these wounds on our syringe exchange. We are doing a lot of wound care. Having that moment where you're doing wound care on somebody or helping someone can really open the door to some meaningful conversations where it may tip us in that there's something else going on. Now, I'm going to warn you, this next slide is a little bit gnarly, but this is what some of those xylazine wounds can look like. They look like really extensive burns. And when somebody is under the effects of xylazine, and sometimes they call it trank dope on the streets, it really, really kind of depresses you. And so these wounds can take a lot to heal. We're going to talk a little bit, like it's often mixed with fentanyl. It can be really dangerous when you mix it with lots of other substances like opioids, alcohol, or benzos. It sedates you. It causes really these bad wounds, like I said. Metamethadone is 200 times stronger than xylazine. and it lasts about 2 to 3 times longer, 2 to 3 hours longer. Both of them causes sedation and hallucination. So it's just, these are really dangerous things that are getting added to our drug supply. Let's see. Nitazines too are much, much stronger. We'll kind of go through this just really super quick, but they are very, very strong. When we compare them in the potency to morphine, you'll see that they are exponentially more potent, and we are seeing those in our drug supply as well. So when you think back of that cycle of addiction with human trafficking and substances, when you're talking about substances that are this potent, that is why that cycle of addiction is so hard to break. And it's just important that we know what it looks like. When we talk about whatever space that you work in, do you have a way to screen for human trafficking? For us in healthcare, you would think all hospitals have a beautiful way to screen for human trafficking, but that's just simply not the case. And like I said, I was not educated on this up until just the last recent few years. You will notice when Cindy was talking to our patient in that video, she used a lot of trauma-informed. She's like, first of all, you are not a junkie. She really met that patient where she was at. There was no judgment. There was no stigma there. It is really important to be able to help these individuals. We have to come at them from all angles. And we have to address the mental health. We have to address the substance use and anything like those big wounds that are pressing needs. So it really does take a team, and we're all part of that team. Let's see what else here. We have a team at Metro Health, which is our navigators. You heard us refer to that in the video. Those are substance use navigators, which are meant to meet someone where they're at, and their job is to help advocate for artists. Is that person ready for change? Where are they at in their stages of change? Are they ready to go to treatment? If not, I'm going to send them home with harm reduction supplies. Our substance use navigators were all cross-trained in human trafficking, and Yurasan, who is here, actually helped to recognize a case in a patient that she was consulting on. And so it's really important that, again, we all get trained on this no matter what space you're working in. Screening at our hospital, we have screening questions. That was not always the case when I was a bedside nurse. We didn't have them. So there's a lot of resources out there. This is what ours look like, not to do a deep dive because we're getting really short on time, but this is a really great tool from the National Human Trafficking Training and Technical Assistance. These are questions that were built by survivors that can be used to ask difficult questions slowly over time. So let's say you're meeting with a client. There's some things, is somebody making you do something that you don't want to do? So you can ask those questions here and there and start maybe putting the puzzle pieces together over time. And so it doesn't have to be all done once in a while. It should be done conversationally. So that is a really good resource that I wanted to share. This is Annette. You may have noticed her from the video. She's actually our victims advocacy specialist, and she played Mary, the advocate, in the video. She is a survivor of both domestic violence, human trafficking. She is a wonderful resource, and actually we met her at the Ohio Attorney General's office on Advocacy Day for human trafficking. And so she joined our team here, and she does a lot of great resources. So that is her work number. Feel free to jot that down. I was just talking to her this morning about a case. And so there's a lot of articles that are now finally coming out, but this has been a very underpublished and understudied area. This is a really great article that I found. It is a little on the older side, but it talks about everything that we're talking about. And this individual was just being kind of cast aside as somebody who is schizophrenic, when here they were actually struggling with substance use disorder and mental health. So just know, these cases are out there. We actually covered this earlier. I know we're getting really short on time here. I'm going to go past this because we actually covered a lot of this as to why and how these substances are so powerfully used. But just know, not everybody who works in this space is anyone can be a trafficker. Let me put it that way. Anyone can be a trafficker. This was a husband and wife team that were actually trafficking individuals out of a treatment facility. This happened down in Florida, but it was at the height of the fentanyl crisis, and they were actively human trafficking individuals. Stimulants, we talked about this earlier. We kind of hit on this, but the stimulants really cause such a massive euphoria that's why it caused such a dependence. It increases someone's compliance. It impairs their judgments. We didn't talk about this, but a drug debt. Women the traffickers will say, oh, we partied all night. Those drugs weren't free. And I know we're super close on time here. The fear of withdrawal speaks volumes in no matter what substance. So opioids, the withdrawal, a lot of people are scared. She referenced that in the video. Stimulant withdrawal, just know when somebody's withdrawing from stimulants, our suicidality really goes up. We're going to go past this slide because this is a little bit more medical. So we talked about cocaine is definitely more of the face of the overdoses here in Cuyahoga County. And one of the things that I'm having to do is actually adapt my education for healthcare providers. And just know that on different levels of trafficking, we have pimp-controlled trafficking, and this is just a really this slide talks about how at every level of trafficking, how substances are used. So there is gang trafficking. Sometimes drugs are used as a recruitment tool as part of the gang recruitment. And this is a really big one that we see. And if I have to end on a note, because I know we're pretty much out of time, familial trafficking happens a lot because substances are involved. And so many of our patients have said, you know what, my parents were selling me some while I was little because they had an addiction and they were selling access to their children. And so when I talk about all those adverse childhood events, just know that that is something that we really see. And that video on familial trafficking is really important because oftentimes family controlled trafficking does happen and usually substances are involved. We can also see survival sex trafficking. So somebody's trading for a roof over their head for substances. And that is also why. So there's many different ways that drugs are used. This was a case here in Ohio. This was a case of a priest that was giving opioids to children so that they could be trafficked. So these are all local. These are Ohio cases. These three mothers were selling access to this man because they had an addiction and they were selling through Facebook, and they were only 7. So this does happen. It is happening in our community, and it's important that we talk about it. This was another case out of Elyria that happened. And just know what your local resources are. This is like my second to the last slide. I just want to stress that substance use disorder treatment to help these individuals needs to happen at every step of the way. Because if the cravings for substances gets to them, we're not going to be able to treat the mental health. We're not going to be able to treat the trauma. And they're going to go back to their trafficker who has been supplying the substances and maybe the housing. And so we really need to kind of go back to that Maslow's hierarchy of needs, but I think we need to treat the substance use disorder. The last thing is, what are your local resources? We are so blessed to have the Northeast Ohio Human Trafficking Task Force here. They cover multiple counties. This is their QR code. It's based right out of the Cuyahoga County Correctional Center. They are available 24/7. And so they are our resource here in Cuyahoga County, Lake County. I believe they cover Geauga as well. But they are phenomenal. And know what hospitals. Here at Metro Health, you are a safe landing zone. We have a really good forensic team, but there are also a lot of other hospitals like Cleveland Clinic and UH that do have programs as well. So know what your resources are. And then if you want to learn more, this is a great resource for education. It's addictiontraining.org. They are phenomenal. They helped me become a certified addiction nurse. And that is my email. I am sorry, I kind of was like rolling through there right at at the end there. But please feel free if you want to know more. I only did this to wet your whistle. This is not meant to make you an expert, and just to start having conversations about this topic. There is so much more to learn, and please feel free to reach out to me if I have confused you, to clarify anything or let you know about resources. Please feel free to reach out, and I will stop sharing.
Thank you so much. That was some wonderful information, and just so happy you could share that with us. I'm trying to jump back into our slide deck here. And I think we did have a question in the chat. Let's see.
It sounds like the question was related to if we're in public and we come across somebody who we believe could be human trafficked, what's the first course of action to talk? Do we contact the local police or the different phone number? I know you put the hotline up
Task
there.
force. Yeah. It would depend if if they were in an unsafe situation that you thought they were being physically harmed, then I would start with 911. My husband has called me, and he works for the natural gas industry, and he has said, like, Chris, I think I'm seeing the red flags for human trafficking. And I said, okay, well, this is the non-emergency number to police. You could always reach out to the task force. But I would say first and foremost, you can reach out to 911 and make sure that that person is safe first, and see what we can do. Because trying to have that conversation with somebody, I would not recommend it. But if you're like, okay, this person is being maybe thrown into a car, get the license plate, call 911. It depends on the situation, but our task force is there. If you're picking up on some red flags, in a different situation, you can always reach out to them and see what do they recommend you do, and they can guide you. That's where I would start, but make sure your personal safety is first and foremost. And if you have to, just activate EMS and just say, I have suspicions something's not right. I don't think this person is safe. I'm not sure what I'm seeing, but I'm afraid for their safety.
And can you share that number? Can you actually put it in the chat if you could?
Yeah. Yes, I will.
And then also for your navigator.
Yeah.
Could you put her name and number in the chat too, as a resource? Because then folks can access the chat following the meeting as well. And
yes,
this is being recorded, so you'll be able to get all this information again if you need it in the recording as well. So we just want to provide a couple of more updates from the Northeast Ohio Opioid Consortium. So our next meeting, our next webinar is coming up in February. Excuse me. The February session is going to be a hybrid session. So there's the opportunity to meet in person. We're partnering with Thrive for Change, who's hosting the in-person event. On February 19th, since it's Heart Month, we're going to have Dr. Bales from Cleveland Clinic join us, and he's going to talk about stimulants and heart health. And so we're excited to learn more. Also, Minreet from the Medical Examiner's Office will be with us to share data, the latest data. And then also in February, we're going to have a community dinner co-hosted with Project White Butterfly on Saturday, February 21st. And this free dinner, we're going to focus the Igniting Compassion screening, the documentary. Actually, Rachel and I are right now in Cincinnati at the Ohio Deflection Association meeting, annual conference. And we just hosted a screening this morning. And we had about 45 people, and they told us, how can we get this word out? How can we share? So the Igniting Compassion is still very popular. And then a couple of more updates from the consortium. So Rachel Summer has really worked hard in the last couple months gearing up for our Speak Bureau. So the Substance Use Prevention, Education, Advocacy, and Knowledge. This is an area we're helping to connect the community, folks who want training and folks who provide training on a variety of different topics: harm reduction, human trafficking, stigma. So this is an area where you can fill out a form if you are looking for a speaker on these substance use, opioid related topics. And then we can connect you to experts locally that have that knowledge that could provide that training. Likewise, if you are a clinician or a community-based organization that has the training, you can also sign up to be part of the Speakers Bureau so that we can connect with you on those opportunities. So we're really excited about that. There's a QR code on the screen that you can access. It's right on our website that you can access this information. And we look forward to connecting with you. I see we have Karen on the line. Karen is the chair of the Prevention and Education Subcommittee of the U.S. Attorney's Heroin and Opioid Action Plan Action Task Force. And we are partnering with Karen and her committee to just coordinate the work and start to plan future programs. And so if you would like to help us plan these education programs and community education, please consider joining this committee, and there's the QR code to join. We have a schedule so we can add you to those meetings. Every other month we're getting together. And it's really been great to talk about what community awareness topics are needed and to help provide that education and help connect folks to those resources. And then we have, of course, our Consortium Chronicle newsletter. If you're not currently receiving this monthly newsletter, please scan the QR code. It's also on our website. So that link on there, it'll take you to a sign up form on the website. Also, all of our past issues, monthly issues. So if you missed one, or I know I'm guilty of my email box being completely unwieldy and I can't sometimes find things, you can get to all the past issues right off of Opioid Consortium website. The Consortium Chronicle provides local updates, state updates, federal updates, and then training opportunities. And then we are also looking for volunteers to serve on our Persons with Lived Experience committee. This working group put together our summer program last year on the experiences of people who are living with chronic pain and may be using opioids for their chronic pain. And so we want to continue to work with this group. We're looking for both experts as well as individuals that have living experience with using opioids for chronic pain. So if you know of anyone or are interested, please contact Rachel and we'll get you involved and in the loop on our next meetings. As I've mentioned, if you've seen it in the chat, we really value your input and feedback on our sessions. We also use this to communicate back to the CDC about the value of the Opioid Consortium as a grantee. And so if you wouldn't mind just taking a few minutes to fill out a quick survey, provide your feedback on this session and maybe topics that you want to hear in the future. Again, we really value your input on this, and we're always striving to make these sessions more informative. The Northeast Ohio Opioid Consortium is hosted by WellLink, and WellLink annual conference is called Connect NEO. It's coming up on May 14th, and I believe registration is going live soon. And so please, we encourage you, a lot of healthcare topics from our region. We encourage you to connect at Connect NEO on May 14th. And now I'll just conclude with any opportunities that you can come off mute if you have questions or any announcements that you all would like to share. Thank you, Rachel, for putting those links in the chat. If you didn't get the links in the slides, we've got the links in the chat for you. Any comments, questions?
I just wanted to say thank you so much. I just always really appreciate hearing your experience, and I always learn something new. So thank you so much.
Thanks, Karen.
Thank you, Karen.
If you know of other organizations, Kristen's always welcome to going out and doing community education. So please feel free to connect with Kristen or connect with us. We'll put you in touch with Kristen if you have opportunities to share this information. Any other comments before we close? Well, we won't keep you. We'll give you back 15 minutes of your day. And I know people tend to have their meetings back to back. So this gives you a chance to go get a beverage or use the restroom, and have a wonderful day. We look forward to seeing you on February 19th or February 21st at our next event.